babies are always to be placed on their back when they sleep, whether it be day or night. It is the safest position for your baby because it reduces the risk of sudden infant death syndrome and also suffocation. The safest place for your baby to sleep is in your room, in their own cot for the first 6 months. I'm now going to demonstrate the positions of which you should put your baby in safely to sleep. Baby should always be placed into the cot with their feet to the foot of the cot. And the reason for this is it will stop your baby, preventing them from wriggling underneath the blankets. So what we recommend is that the baby's feet are to the foot of the cot so they have nowhere else to go. So it could be the cot, it could be the Moses basket, it could be the crib. It's whatever place your baby is sleeping. So feet to the bottom. Blankets then should be tucked loosely across at shoulder level. The other thing we do recommend is that if you can use the cellular blankets. So the cellular blankets are the ones with the holes in them, and they're aerated so that more air can go down through it and help your baby's temperature to be maintained and cool themselves down if they do get too hot. Another thing to remember is that there shouldn't be anything else in the cot. So no fluffy toys, nothing that can cause suffocation risk, so no bumper pads, toys, or any extra garments in the cot. Your baby's head should always remain uncovered because, again, if your baby gets too hot, they can lose some of their temperature out through the top of their head, and that helps to prevent them from overheating. If you do decide to use a sleeping bag, make sure that the sleeping bag is the correct size for your baby. So for this baby, we would be using a small newborn sleeping bag. You'd have a low TOG quality, and you'd ensure that the bag had no sleeping bag had no hood. Something similar to this, where their sleeping bag would fit the baby's size, that their arms could be out freely, and that it's a low TOG quality. We don't recommend co-sleeping with your baby, as there is an increased risk that the baby may overheat. Sometimes as well you may roll over onto your baby and there's an increased risk of suffocation. It is important not to sleep with your baby in the bed. If you are a smoker, if you've taken alcohol, if you've taken any drugs, be it illegal or illegal drug use, anything that would make you drowsy, or if you're extremely overtired. We also recommend that you do not sleep with your baby in the bed if they are less than 3 months old, if they were born before 37 weeks, or if they weighed less than 2.5 kgs. Cot death doesn't automatically happen in a cot. It can also happen in a bed, a pram, or a car seat. It is important to maintain the safe sleep positions no matter where your baby sleeps, so always remember to keep your baby on their back. Never leave your baby unsupervised in a sitting position such as car seats, bouncers, or anything similar like that. We don't recommend that the baby is left sleeping in those unsupervised. So normally the room temperature should be anything between 16 to 20 degrees. And so you judge it by yourself. If you're comfortable in your room environment, the baby should be comfortable as well too. Use the cellular blankets, as I said, feet to the foot of the cot, blankets loosely across the shoulder level, nothing covering the baby's head, and if your baby seems unwell, seek medical attention.